One of the common things that we have patients actually coming in with is anxiety. Very difficult to treat, oftentimes misunderstood. The anti-anxiety medicine is one of the biggest sellers out there, and it does have some good relief that's associated with it, but oftentimes doesn't get to the underlying problem. And then also, as you're taking if you are taking an anti-anxiety medicine, there is a level that over a period of time that it doesn't work for you. So then you have to go on to another anti-anxiety medicine, and again you can have some very, very awful side effects that are associated with that, and then also the amount of time that it's actually helpful is not a permanent type of solution. What we do here at Meridian Health and Wellness is to look for the underlying cause. There are many different types of reasons why people can have anxiety problems, and as we are looking at that, we find that underlying problem. An example would be, as I had a patient came in here, he was taking some anti-anxiety medicine because he had been a public speaker and had been quite good at it, and had actually traveled all across the United States doing speaking, and he after a period of time he couldn't actually get up there in front of people, which was very unusual. His hands were sweating, he couldn't speak, his knees were getting weak, and he actually had fainted. You know, what was the problem that was actually going on? And as we did the lab tests, we found that his adrenals had basically been shot. Probably because he had overdone, had overcommitted, and had not really taken care of himself. So we started him on some different types of natural products to help to rebuild his adrenals. He saw an immediate difference, and within 3 months he was back to his normal self. He could actually speak. He didn't actually get back into that lifestyle because he didn't want it to actually occur again. But understanding that underlying problem where that wasn't even looked at, why he had the anxiety, which didn't really make sense to him. Very intelligent man, and knew that there was a reason for it and wanted to know exactly what it was. Another female, actually, woman came in here. She had been a very good wife, good mother, had actually gotten along in some years, and had actually started to have some panic attacks for no known reason. She had a good life, and no heavy different types of things that occurred. As we checked on her, we found that she had a high copper level. High copper is one of the things that actually overexcites the nervous system, and she was actually, because of that, having some anxiety. So we started her on a program for being able to take down the high copper. There was some minerals that we gave. Zinc is very good. We gave her homeopathic to help to reduce the copper levels. Cilantro tablets, very good for helping to pull the copper out. Again, we were able to check the body again in 3 months, found that the copper levels had dropped down to normal levels, and her anxiety was under control. But looking for those underlying problems, because nothing happens in a vacuum. There's always a reason for it. Yes, it is important to look at pharmaceuticals to get emergencies under control, but you're really not looking at the underlying problem and completely fixing it, because the copper levels, the low adrenals was there whether they were taking medicines or not, and causing other different types of problems. Symptoms are a warning that something's wrong, and when the body isn't working right, when the emotions aren't working right, there's always a reason for it. What we do is we find it here at Meridian Health and Wellness, and we figure out how to fix it.